Welcome, and thank you so much for the opportunity to speak with you via video. Congratulations to the Chinese Preventive Medicine Association and its partners for convening this think tank. This is the sort of high-level action China and the world need to combat NCDs. NCDs are on the rise, and they undermine both health and economic progress. Our task is well-defined. We know which NCDs cause the greatest burden of illness, disability, economic loss, and death. We know what the major risk factors are and how to prevent them. We know which treatments are most effective. We have the expertise and tools to address and reverse the epidemic of non-communicable diseases. Now what we need to do is take what we know and put it into practice at scale. China has a high burden of NCDs. They currently account for nearly 9 out of every 10 deaths. Nearly 1 out of every 4 adults in China has high blood pressure, and more people die from high blood pressure in China than in any other country. There are an estimated 2.4 million strokes a year and more than 2 million stroke-related deaths every year. And unless China takes urgent action, more than 150 million current smokers will be killed by tobacco. This think tank can play a critical role accelerating NCD prevention and control. One of those key roles will be to provide scientific and medical expertise to document and advocate for the implementation of interventions that are proven to work. Another equally important role will be to partner with national and state governments and health systems. The United Nations Agenda for Sustainable Development, adopted in 2015, builds on decades of work globally. The SDGs are an urgent call to action. They have agreed goals in 17 areas for every country in the world to be met by 2030. In particular, SDG 3.4.1 aims to reduce early death from NCDs by 1/3. This is possible through improved prevention and treatment. Reducing death from these causes by 1/3 in 15 years is an ambitious but achievable goal. The Healthy China 2030 policy is an important means to achieve the SDG goals. The goals of Healthy China can only be met by bold and effective action on 2 fronts. First, health policies, particularly taxation, regulation, and legislation. Second, improved primary care with a focus on effective management of high blood pressure and successful prevention and treatment of certain cancers. Healthy China 2030 has established a goal of 30% relative reduction in NCD mortality between 2015 and 2030. Some specific targets include reducing adult smoking by nearly 1/3, cutting dietary sodium consumption in half, and tripling high blood pressure control rates to more than 50%. At Resolve, we're also supporting efforts to reduce sodium consumption. This is particularly important for China, with its very high burden of high blood pressure and related diseases. And it's been called for in the Healthy China 2030 policy. Potassium-enriched salts have great potential, as do warning labels on high sodium products and scalable models of public education. At Resolve, we're also supporting efforts to improve treatment of high blood pressure. In China and globally, only 10 to 15% of people with hypertension have it under control. Yet Thailand has achieved approximately 35% control, and Canada nearly 70%. Improving hypertension control both requires and facilitates improvement in primary care. The goals that China has set for itself, which if achieved will prevent disability, death, and devastating economic costs, require effective treatment of tens of millions of more people for high blood pressure. This will only be possible with a public health model of hypertension treatment. Resolve to Save Lives is honored to be registered in China and to work with partners at the national and many provincial levels to reduce sodium and better treat hypertension. Congratulations again on convening this think tank. It's an important step forward to address and win the battle against NCDs. Action will be critical to success. Perhaps moving from thinking to action can be a theme of this think tank. Thank you very much.